and not necessarily those of this station, its staff, management, or sponsors.
Welcome to How to Stay Healthy, where we interview doctors each week across the vast medical landscape of cardiology, neurology, orthopedics, sports medicine, and primary care. Join us here for your prescription to better health. Hello, South Florida and beyond, and welcome to the How to Stay Healthy show. We're talking orthopedic surgery all week, if you remember Tuesday's show, and we're going to continue it as well tonight, and also talk about the compassionate use of medical marijuana clinic locally here in Boca Raton. You may be familiar with, you may not, but we're definitely going to get you the info on that show as well, or on that clinic, I should say. Just want to give a shout out to Dr. Stuart Himmelstein, Internal Medicine, Delray Medical Center. If you remember, he was on this show last year. He's actually needs a kidney transplant, so best wishes to Dr. Himmelstein. We want to get him back on the program and see how we can help in any way. So, again, best wishes, Dr. Himmelstein. Without further ado, though, I want to get started here because we got a lot to talk about. And welcome back to the program, Dr. John Baker. He's an orthopedic surgeon from West Boca on the show. And his practice is Allegiance Orthopedic and Spine Institute. Dr. Baker, welcome back to the program. How are you doing this evening?
I'm doing great. Thank you.
And thank you. We should have a lot of viewers and listeners. It's been really rainy, so,
Yes.
And so we can get started. So I want to start with the clinic first. So right now in the Boca newspaper, if you check it out, bocanewspaper.com and delraynewspaper.com, big shout out to them. I actually wrote a story from our last interview called Local Doctor Helping to Treat Pain, Sleep Apnea, and Ailments with Medical Cannabis. So let's start there. I know you have the clinic. Give us the clinic name and tell us a little bit about, I guess the first question is, who is a candidate for medical marijuana, and how can they get this card that everyone's talking about?
So first of all, the clinic, thanks a lot to have me back on. I appreciate it. The clinic is in Boca Raton and Delray Medical Center. Delray, my Delray office and my Boca office. It's on Glades and Lyons in Boca, and then Delray, it's off of Congress between Atlantic and Linton Boulevard. The clinic has done very well. In fact, so far, I've probably wrote about 175 prescriptions, and I have about 100% success rate with this clinic. I have patients coming back into my office. They're been on pain meds forever, back pain, neck pain, anxiety, can't sleep at night, sleep apnea, all kinds of different things that are affecting them. They've been on these doses now for a period of time. They get their card, they go to the pharmacy, they finally get their medication, it ships it to their home.
Oh, nice.
Once they get everything set up. And they're very, very happy. They're coming back in. They're asking me, where do I put my narcotics? How do I get rid of these, doc? Because I don't want these anymore. No more oxycodones, no more hydrocodones, no more OxyContin, those kind of things. So they've been doing very well on it. The medicine's working. The dosing is working for them. They have a different dosing for daytime so they can still function and work. And then at nighttime, they have a little bit different dosing to help them sleep at night. And the patients are coming back, they're able to sleep. These are people that work up all night, they couldn't sleep, they were taking pain pills, they were taking, Ambiens, different kind of medication to sleep, and now they're no longer doing that.
It's funny you mentioned sleep because that's kind of one of the best prescriptions for getting better from ailments is sleep. And if you're not sleeping, the body doesn't have a chance to recharge. And I didn't know that, sleep apnea is also on the list for medical marijuana. So they come into your office now, and it's CAM, you call it, right? Clinical for compassionate alternative medicine.
Yes, it's called CCAM.
CCAM,
Yes. Mm-hmm.
That's what I meant.
Yep.
And they just come into your office, and you see them for whatever ailments they describe to you, and at that time, do you make a determination if you can move this forward with the state? Is that how it works?
Yes, they have to be a candidate, obviously,
Okay,
and they have to be able to fit into that candidate process. But once they come in, they have their their treatments with them. They bring their MRIs. They bring, whatever's going on with them. We go over their history. We go over their physical exam. We look at their MRIs, all their studies and whatever. If they fit that process where they're a candidate for the state, which is kind of still iffy of what really is a candidate because they throw it out there that pain could be kind of there, but you have to kind of put it as what kind of pain it is. But for the most part, a lot of people do qualify for it. And when you do, then we sign them up. We do a consult. We sign them up with the state. They go on the computer. They do an email with the computer from the state, and then they have to get their card from the state within about 30, 60 days. Once they got their card, they go to the pharmacy one time just to get everything set up with the pharmacy so they can ID them, do their card, look at everything, make sure it's legitimate, and then everything else is sent home to their house. So it's once they do that, they get it every month. It comes in every couple weeks, and you can do either sublingual, where you do drops underneath the tongue, or they can do vape. And the vaping is the majority of the people want to vape because it's easier to do that way, and it's just a liquid form. And there's multiple strains of the marijuana they do, and they just kind of change it up to balance it out for whatever they need.
Oh, that's great. So, again, Dr. Baker's Compassionate Care Alternative Medicine, CCAM Clinic, is at 9033 Glades Road, Suite B, Boca Raton, and 190 Congress Park Drive, Suite 160 in Delray Beach.
That's correct. And they can reach us on the phone number 561-706-9189. That's our direct line to the CCAM Clinic. You can also call my office, but that would be easier because then they can book you directly with me for the CCAM rather than it being an orthopedic evaluation.
Exactly, for the CCAM Clinic. And I even have an email here, ccam.medical@gmail.com.
That's correct.
That works as well. So you're probably wondering what I'm doing over here with the computer and this and that. We're on Facebook Live.
Nice.
And I was just sharing it. I saw we already have 4 viewers, so that was pretty quick. It builds as the show goes on. It's wild. But anyways, so the reason I brought that up is anyone who wants to go back to this show to get any of this information, all you do is go to Facebook and you type in All County Healthcare INC, the sponsor of the show, or just All County Healthcare. Their page will come up and all the radio shows are there, the radio video shows. Or you can go to allcountyhealthcare.com. Big shout out to them for sponsoring. And again, all the shows are there. So you can go back and jot down any of this info. But I'll give it out a few times. And like I said, please read the article in Boca Newspaper and Delray Newspaper. It's in there right now. Or you can get it online, bocanewspaper.com, delraynewspaper.com. And once again, the headline is local doctor helping treat pain, sleep apnea, which really surprised me. And, you know, I want to look into this because I've had a hard time getting a sleep study because I'm on the cusp of, I don't have prediabetes, but they're always checking my blood. And if I don't get a blood test on time, I can't get the sleep study. But maybe that could be the start of it. And then other ailments, like you talked a lot about pain. And I talked last time on the program here. I had some friends who had got hooked on opiates for different reasons, some of them injuries, whatnot, some of them not. But long story there. But great that, something besides like the Percocet, the Vicodin, or even the heavier stuff like the Oxycontin and whatnot.
Totally agree. And just to have the patience, when I first started with the CCAM and the marijuana, everybody's a little bit iffy on doing that as doctors. We're taught to give out medication. We're taught to do things like that. But I can tell you, I've had a very, very good success rate so far. I've been doing this for about 8 months now, and the patients are doing very, very well on it. They're coming back. They're like, Doc, I slept 8 hours. I haven't slept 8 hours in 15 years. They're like, I don't have pain. During the daytime, I'm able to do my job. They can function on it without being on something that's could really be detrimental. Taking pain meds during the day when you're trying to do construction or putting a house together or that kind of work. When you can do this and it's really not going to affect them, it's a great thing.
Yeah, it's not going to make you as drowsy and
exactly.
all those side effects. So again, check out Dr. Baker there, and we'll give out the info a few times. I also wanted to have you on the other show though, because you're a practicing orthopedic surgeon and sports medicine specialist, and that was the newest news. But you also see patients for a ton of ailments, and we mentioned West Boca Medical Center where you're on staff at, but also your practice Allegiance Orthopedic and Spine Institute. One of the questions I had is kind of getting to the age, and I feel a lot of pains in the joints and stuff. I want to ask a little bit about arthritis. So I got an orthopedic surgeon here, sports medicine specialist. I have to ask you, what is arthritis?
So first of all, it's wear and tear of the joints. And as we get older, we lose water in our cartilage. And what happens is we get some degeneration in that cartilage. And as the cartilage degenerates, it becomes, osteoarthritic, because that's what we call it. There is like rheumatoid and other diseases that affect the cartilage, but really it's the osteoarthritis. It's a breakdown of the water, a loss of water in the cartilage itself. And then as that water escapes, we lose our amino acids and our glycoamino acids and different things, and so the cartilage tends to break down. And once that cartilage starts to break down, there's really not much you can do for that unless you get it early. So one of the things that we've talked about previously was, a lot of us guys in sports medicine now, we're doing a lot more stem cell, a lot more PRP, so platelet-rich plasma, where we draw your blood in the early stages in order to help that area heal. And we had very, very good results with that, doing those kind of things. So it's just a matter of the cartilage breaking down, the knee breaking down. As we get older, that's what happens. After age 30, it's like, people think it's like, 50, 60. It's not. It's really at age 30, we start to see degeneration in our tendons, our ligaments, our bones, and the cartilage, and you start to see some wear and tear, and that's what happens. And, young patients, we don't want to have that happen because you don't want to do a total joint on somebody in their 40s or 50s. We'd hopefully push them off to 60, 65, 70, where that's going to last till they die. Mm-hmm. So we don't have to keep redoing that,
Yeah, definitely. And you nailed it right on the head there. Definitely started feeling around 30. I'm 40 now. I'd have trouble walking 18 holes because of the pain in the joints, to be honest with you. I used to walk 18 holes golf all the time. So definitely want to come by and see you for that. Talk a little bit about the management of arthritis from a sports medicine or orthopedic surgery standpoint. Like, what can you do? The PRP injections is one of them. So that's platelet-rich plasma injections, PRP. And can that be done like over like a lunch break and within an hour of coming into your office?
Yeah, we could do it in the clinic within like 30 minutes. Basically, you just come in, we draw your blood, we spin it down. It takes about 25 minutes to spin it down, and then you just inject it. So you're probably there maybe 35 minutes.
Okay.
To have the whole process done. And basically, again, what we're doing on a younger person, if I'm drawing your own blood and you're young, and I mean young now is under 55, 60.
Hey, nice.
It used to be, young was like, whatever. But these patients are living longer. People are active. I did a total knee on a lady 92 years old 2 weeks ago.
Wow.
All right, she's a tennis player. She's happy. She just couldn't play anymore.
I was going to say tennis or golf.
Yeah, so she likes to play tennis. So I put a new knee in her, and she's back. She wants back out there, wants to go out there and hit. But yeah, you can do that within about 45 minutes, 45 minutes. It's a quick process. And again, we draw your blood. And if you're young, it's your own platelets that we're using. It's your own blood, your own stem cells. But we're just putting in a spot where it's going to heal. Where rather than your body is not going to do that with an inflammatory process, it takes time for that to heal. This puts it right there, so that affects it right then and there.
Nice. And those PRP injections at Allegiance Orthopedic and Spine Institute. We're getting a lot of hits on Facebook. I'm just watching them come in. Louis Raybar Jr. He says, great doctor. So he's familiar with you. And we already have 25 shares, so I always like to say that. I got some great info on your website this morning as I was doing my research for this program, allegianceorthopedic.com, and I'll give that out again. So I was looking there, and the second part was fractures. And then I looked in a little bit more, and it's right here. Bones are the hardest tissues in the body. I never thought of bones as a tissue. So that said, when those tissues break or fracture, why is it important to get evaluated from an orthopedic surgeon or sports medicine specialist?
Well, first of all, if you fracture like a young, like somebody falls and they break their wrist, which is one of the most fractures
is that the
we
most
see.
Common?
Very common.
Really?
Wrist fracture, very common. But we also see in a lot of people that are younger, we see stress fractures. And so what will happen is you have somebody that runs or they do things a little bit too much and extreme, and they're not ready for it. They'll get what's called a stress fracture, and you won't really pick that up sometimes on an X-ray. You'll pick it up on an MRI. But those are things that you want to know. But yeah, a lot of times we'll see like a wrist fracture, or we'll see a hip fracture, or something like that in the younger person, just from falling or doing certain things, and we'll pick those up in the emergency room, and then we have to treat those. But yeah, the bone is very hard. But it is a tissue still. There's cells there. There's soft tissue. There's, inside the bone marrow, you have all your cells and your hemoglobin, all those different things that we have that do that. But yeah, the bone is usually tough to break, but it can happen. And when we stress something out, like somebody that's, say, a weekend warrior that gets out there and is trying to do something too much, they can stress out and get what we call a metatarsal fracture in the foot or a hip fracture up in the hip. When in the stress fractures, you have to treat those, so.
Definitely. Now, what are the latest treatment options available for fractures?
So Depends on what the fracture is. If it's non-displaced, in other words, it hasn't moved too much and it's in a good position, you can treat those just usually with a cast and let it heal. If it's a hip fracture or it's a stress fracture, something like that, it depends on what there's what we call a tension side or compression side. If it's on the tension side, we worry about that because that can go all the way through. And in somebody that's young, you don't want that to happen. So a lot of times that's surgery. We'd have to do a surgery on that. But most of the time we can put them in a boot for the foot. For the wrist, we put them in like a brace or a cast or whatever, just to let everything settle down. If it's displaced, depends on how far it's displaced, depends on if it needs surgery. And that's kind of what you look at.
I always like the fact when I interview you, you always look for the management other ways other than surgery first.
Yes, because I
think
mean,
that's
I'm a surgeon. I love to do surgery, obviously. But, nowadays, not everybody needs surgery. And, I mean, I look at myself. Would I want to have surgery if I don't need surgery? And now we have so many technologies out there. It's not always everybody needs surgery. But, sometimes you do. And if we do, we do. If we don't, we don't.
That's great. I mean, you're offering the medical marijuana clinic for pain from these joints that have pain. And then you're also offering the non-surgical, which I kind of look more at sports medicine side of things, management as well. And then if, you have to do surgery, we're going to schedule surgery. We're going to come up with a plan here to fix this fracture or whatever else, or maybe a ligament that's ripped as well. So I also always find it fascinating, orthopedic surgeon, you also treat foot and ankle injuries as well. So
Yes.
it's not, I'm thinking orthopedics, I always think knee, to be honest with you. You mentioned wrist, but you yourself treat wrist, elbow, shoulder, knee, foot, and ankle. I'm probably missing something there.
And hip. And
there it was.
Yep. Anything in the joints, that's orthopedics. We do joints, we do muscle, we do tendon, we do fracture, we do all that stuff.
And we're here with Dr. John Baker, orthopedic surgeon and sports medicine specialist. You can see all his areas of interest. Again, it's allegianceorthopedic.com. And then he's also on staff at West Boca Medical Center. So his phone number is 561-330-4358, and I'll give that out a few times. But I was saying about the website, you have it all broken down. There's a part about foot and ankle, podiatry, shoulder, elbow, hip, knee, and it shows all your areas of interest. And if you click on that, you get even more info. So I wanted to ask you, in terms of shoulder and elbow, I saw in there a little bit, and this is important. You already mentioned tennis. The woman was playing tennis that you helped out. But tell me a little bit about tennis elbow, golfer's elbow. We've heard of them, but if we haven't had them, pitcher's elbow, what happens there, and why is it so painful?
Okay, so in tennis elbow, it's your two extensor. It's basically your extensor tendons that attach to the lateral epicondyle on your elbow here, up the up portion. And so what happens is it's an overuse kind of injury, and you get some degeneration in those two tendons, and then they start to get a little microfracture tear or small tear in them, and it really is more of like a tendinosis. And when we say tendinosis, it's not just a tendonitis. So a tendonitis means the tendon's inflamed. A nosis means it's inflamed, but you get scar tissue, it breaks down, it doesn't really heal properly, and whatever. Those are perfect candidates for PRP. Those are patients that do very well with PRP, because otherwise you're opening the elbow, you're taking that tendon off the bone, scraping that bone, and then attaching the tendon back to the bone. So it's a huge procedure for somebody to undergo, but not everybody gets better with PRP, but I would try PRP for that in the beginning. For a golfer's elbow, it's the same thing, but it's on the inside part of the elbow, and it's on the medial side, and that's where the flexor tendons attach. So the flexors allow you to flex your wrist and move that through the wrist portion. And when that happens, we call it golfer's elbow because usually what happens is from swinging too hard, or a chip shot, or you come down and you take out too much grass, and and you've tried to chip that ball. But what happens is you hit the hot ground so hard, you're swinging through, and you catch this, and your wrist is in flexion as you're coming through, and it tears that flexor tendon off the bone there. So you get like a little partial fracture or partial injury to the flexor. So tennis elbow is on the outside, golfer's elbow is on the inside. Both can be treated with PRP, and what you're trying to do is get that tendon where it attaches to the bone to heal.
I see. And pitcher's elbow, is that kind of combination of the two or different? Is that what we hear about when people need like Tommy John surgery?
That's Tommy John, yeah. So what happens, the ulnar collateral ligament, as we go through, yeah, the UCL, exactly. The ulnar collateral ligament on the elbow, when you're doing a follow-through, when you're pitching, and we see that in a lot more people that pitch, or the younger patients that don't pitch right.
Or throwing the curveball.
They're throwing the curveball, and they're not giving them enough rest. All right, so you got the coach that's got this kid that's like 12, that's the best pitcher on his team, right? And he's pitching but he's having him pitch like every other day or every day, because he's the best pitcher on his team.
Gonna pitch him to the Little League World Series kind of thing.
So that's where you end up hurting that ulnar collateral ligament. If that thing tears, then you have to a lot of times you have to reconstruct that, and that ligament attaches there, and that's what allows you with a overthrow when you're coming through with a follow up or you're coming through. That allows you to let that ball go. And so if you don't have that, you can imagine when you're coming through, that ligament's gone. There's no follow-through. And so that's what Tommy John surgery does. It reconstructs that ligament.
So you do the Tommy John surgery?
Yes.
Okay, because we hear so much about it. I'm always wondering who does it. And I got to give another shout. I was just looking online. My pitching coach back in the day, Gil Patterson, he played for the Yankees in 1977. He threw too many curveballs, and he used to tell us, guys, you don't need to throw curveballs yet. Wait till later on. I thank him for that because, man, that can really tear up your arm, like you said, if it's overused.
Exactly. And the curveball puts a lot of pressure through your elbow. A lot of pressure through the elbow.
Yeah, you really shouldn't be throwing until you get to the, later in amateur baseball or maybe college or
once the growth plates close, that's the big thing. And so, usually in boys we say that, boys, the growth plates close around 16, girls close around 14. So once those growth plate closes and everything kind of settles down, then you're able to do those kind of things. But when those growth plates are still open, you still have an opportunity to really pull off that medial epicondyle or really hurt that, and that's the biggest problem they usually have with that.
Now, all of these terms are on the website as well, allegianceorthopedic.com. And another question I wanted to ask you since we have you here, are sprains and strains different than fractures?
Yes.
They are?
Yes.
Now, so tell me a little bit about a sprain or a strain.
Okay, so strain usually is talking about the muscle-tendon junction, and a sprain is talking about ligament to bone.
I see.
So when you roll your ankle and they tell you have a bad ankle sprain, it's not fractured. You haven't broke the bone, but you've torn the ligaments, or you've injured the ligaments. So like a grade 1 sprain, you might have like a partial tear. A grade 2 in the ankle, you might have a little bit more of a tear. A grade 3, you've really kind of torn the ligaments off the bone, and that's what we see when you do that. And so it's more ligamentous to bone with a sprain, and a strain is more tendon. So it's more the muscle-tendon junction. So as the tendon is inserting into the bone, it's at that tendon-muscle junction that you usually see the strain. It could be in the strain in the muscle or in the tendon itself. And a sprain really is more ligamentous injury, like rolling your ankle, or I pulled my hip, I have a hip sprain, something like that.
And can those sprains and strains be managed non-surgically?
Yes, the majority are.
Majority.
Most of them are, yeah.
Unless the ligament is completely torn, then it becomes
If you have instability in the ankle, like say somebody really has a really bad sprain, but they didn't tear anything. I mean, they didn't break anything. You can still have a really bad sprain where it's a grade 3, and that means it's torn. If after you let it heal and we get your weight bearing on it and you're still having a problem with it and it's still unstable, then you have to do a ligamentous reconstruction for those. But the majority of those will heal as long as you treat them not like we used to. When I trained, we used to keep them on crutches, keep their ankle, keep them not weight bearing on it. We found out that's bad. You want to put them in a boot or something and get them walking on it immediately so that they still have some motion through that area, so that sprain will heal.
Oh, okay. It's changed over time.
Yes.
That's great to know. Now we're here with Dr. John Baker, once again, Allegiance Orthopedic and Spine Institute in Boca Raton and Delray Beach, and he's on staff at West Boca Medical Center as well. I alluded to the beginning of the program a little bit about osteoarthritis. Correct me if I'm wrong, but I did a little research, and with the baby boomer population growing, is osteoarthritis one of the things that's kind of on the rise?
Yeah, and what's happening is that it's not so much the baby, it's the baby boomers, that's true. But what's also happening is people are living longer. Oh. And so, again, you got somebody that's in their 70s or 80s now, they're still active, but they're bone on bone. Imagine the cartilage is completely gone in the knee, and you're bone on bone. So you're rubbing bone on bone in a knee, for example, or a hip or whatever. And, it's affecting their life. And a lot of them come to Florida, and they want to come down here and enjoy things and do stuff. Unfortunately, when they're bone on bone, they can't get around. They can't walk. They can't do the things they want to do. They're using a cane and stuff like that. And the baby boomers now are so active that, it's good to run, it's good to do things, but everything in moderation. And so when you have these people that want to run, 60 miles a week or whatever, it's not good for your knees. It's not good. And you'll see a lot of these runners end up having to have a total knee replacement early because they ran so much. So it's good to run. It's good to be active. It's good to get out there. But you have to understand the cartilage also needs to rest, and you can't run all the time on it. So,
Well, if you need to get back to quality of life, definitely see Dr. John Baker, orthopedic surgeon and sports medicine specialist. And that's what it's all about, right? Is getting people back to their quality of life, no matter what age.
Yeah, just be happy. You know, I mean, we live in Florida. I mean, it's a great place to live. I mean, I was so lucky to be able to come here, out of my residency program after I finished up my military career, and come to Florida, where you can boat, you can ski, you can walk the beach, you can do whatever. But if you're hurting and you can't do that, that's not a quality of life you want. You want to be able to get out there and walk on that beach, enjoy your life, get out there and do the things you want to do. So those are the things that we can do. And again, with the younger people, the PRP is so huge now with the stem cell and the PRP that we're able to treat people and get them back to being able to do those kind of things they want to do where they couldn't do that before without, a steroid injection or surgery or all these other things where we don't have to do those things anymore.
That's great. Well, thank you for coming back on the program. We'd love to have you on again in the future. You know that.
Yep.
And check Dr. Baker out, allegianceorthopedic.com. Thank you.
Thank you.
For a prescription to better health from the top doctors in the medical fields of cardiology, neurology, orthopedics, sports medicine, and primary care, join us each week on the How to Stay Healthy show.